We are creating a new single hospital service for the City of Manchester, Trafford and the wider communities our hospitals serve. This means bringing together Central Manchester University Hospitals NHS Foundation Trust, CMFT, and University Hospital of South Manchester NHS Foundation Trust, UHSM, to create one citywide hospital trust from October the 1st. The new trust includes Manchester Royal Infirmary, MRI, St Mary's Hospital, Royal Manchester Children's Hospital, Manchester Royal Eye Hospital, University Dental Hospital of Manchester, Trafford General Hospital, Altrincham Hospital, Wythenshawe Hospital and Withington Community Hospital. Once MFT is established, the plan is to integrate North Manchester General Hospital around 12 to 18 months later. So why is this necessary and how will it be better for patients?
The merger of UHSM and CMFT really gives us a once-in-a-lifetime chance to address some of the appalling health inequalities in the City of Manchester and start to provide consistently excellent services, irrespective of which part of the city our patients come from.
Bringing our hospitals together into one organisation will ensure consistent, high-quality care for patients wherever they're treated. The plans have been through a really rigorous approval process, including assessment by the Competition and Markets Authority. I've been really impressed by the huge amount of work that staff across both trusts have done to deliver this vision.
I think the opportunity that we've got with this single service is absolutely fantastic. Each of the hospitals that we've currently got in Manchester are brilliant on their own right. However, despite that, there are things that they can't do on their own. By bringing them together, you start providing a critical mass of services, and it allows us to actually start providing services in a way that we can't do individually at the moment.
I'm proud to have worked at UHSM and actually the opportunity to still continue working based here with the excellent team that we have both at UHSM, but also to work and together with our colleagues in Trafford and Altrincham. I think we'll bring a holistic package of care to the patients of our local populations, which is both the borough of Trafford as well as the borough of Manchester.
I'm really proud of the services we provide to our patients day in, day out. But as one brand new organisation, we really can share our strengths and develop excellence in a way that we've never had the opportunity to before.
Bringing all the hospitals together into one trust will mean our highly skilled doctors, nurses, other health professionals and non-clinical staff will be able to work together much more easily.
Just thinking about some of the benefits for our patients. So if you're a patient on our respiratory ward at the Manchester Royal Infirmary and you really need some expert help from some of the nurses at Wythenshawe, then those nurses can visit the patients at the MRI without having to complete paperwork and look at access and ask permission to attend, and patients can benefit from quicker and faster treatment.
Patients who come to hospitals that already do research, those patients tend to get a better deal anyway, get better outcomes. But now we can make it easier for people to participate in clinical trials, make it easier to recruit them into those trials. We just have fantastic opportunities that we didn't have before as separate organisations.
The creation of the new organisation has been approved by the Competition and Markets Authority, who said it would benefit patients including those at risk of heart attacks, strokes and those in need of vascular surgery or kidney stone removal. Here, some of the lead clinicians explain why they think patients will benefit.
Type aortic dissection is a condition in which the big pipe that leaves the heart, which is called aorta, there is a tear within the pipe. It is one of the most fatal cardiac surgery emergencies. We do not have enough resources at either of these sites to run a rota of surgeons who could provide this specific service for Greater Manchester. Unifying these two trusts, we will get a pool of surgeons who could specifically perform this kind of surgery and get better results.
What we're looking at with a bigger team across the organisations is the ability to provide the service 7 days a week for patients, so they get a quicker treatment. It avoids any risk of deterioration while they're waiting, and it gets them home quicker. And for many patients like that, these are quite elderly patients, the longer they're in a hospital bed for, the longer it takes them to recover. So we think there's real benefits to patients from getting quicker access to specialist care.
One of the benefits is if you have a miscarriage at the moment and you need an operation, if an emergency case comes in, that operation may be cancelled. However, by offering an additional list at our Wythenshawe site, will reduce the chances of this happening.
Kidney stones come on suddenly and can cause a lot of pain and suffering to patients. We aim through the new single hospital service to offer a more responsive, quicker and better treatment plan for these patients.
Plans to create the single hospital service are part of the Manchester Locality Plan to join up health and social care services across our city more effectively. The new single trust will not only improve links between our hospitals but also with GPs.
So I think for primary care, creating a single hospital service will be a big step forward for my patients. It should give them better choice of site at which they receive their investigations or treatment, and probably more importantly, it should improve the communication between the different hospitals and the GP surgeries.
As we mentioned earlier, once the new trust is established, the plan is to integrate North Manchester General Hospital 12 to 18 months later. At the moment, North Manchester is part of Pennine Acute Trust, which also oversees hospitals in Bury, Oldham and Rochdale.
We serve a population with complex health needs, and so there'll always be the need to access strong hospital services from North Manchester. We're running a number of engagement events with the single hospital service team, so there will be plenty of opportunities for the staff of North Manchester to get involved in those discussions.
From day one of the new trust, October 1st, we are focusing on keeping services running safely as usual. And you'll see little change if you need to go to hospital. If there are any significant changes to services, public consultation will take place as appropriate. This is an exciting time, and we want you to come on a journey with us to make Manchester University NHS Foundation Trust the very best it can be for patients. We will keep you updated during the coming months.